So if your back pain is coming back, then again you're amongst friends. If you have an episode of back pain, unfortunately the research shows us that you're actually more likely to have another episode of back pain. But each time doesn't mean that you're going to have worse and worse episodes and it's going to contribute to major problems in your life. So it's important to manage your pain in the best possible way, as you did the first time that you had back pain. Stay active, get back to work as quick as you can, and get back to your normal activities to the best of your capability.
If you've had back pain once, you're likely to have recurrent episodes of back pain. Most people can resume their normal activities and their normal work, the things that they like to do, and live with their back pain. That doesn't say that you have it all the time, but it's not uncommon to have a few episodes here and there. The most important thing, I think, is that you do continue with your normal lifestyle. It's almost that you're going to do your activities despite any sort of pain that you might get, and I think that's important. The fact that you're getting recurrent episodes of back pain doesn't mean that you're causing further damage to your back. Unfortunately, it's just one of those things that happen. But I think it is important that you take stock and you learn how to move, how to use your back without putting undue stress on it. And also importantly, that you learn what to do if you can feel that you're about to get an episode of back pain.
Stop looking for that silver bullet, that diagnosis that's going to fix things, because it will be complex and it won't just be one thing. And number two, make sure that you stay in charge of the decisions that you make, because that's going to contribute to your pain if you're not in charge.
I think you must respect your pain, but it's equally as important that you resume your normal functional activities as soon as it's possible. And if you find after a week or 10 days that you're getting no improvement in your back, or in fact you think your back is getting worse, then it's time to see a health professional such as a physiotherapist.
In terms of going to see a health professional, I don't think it's necessary to do it at the first sign of low back pain. I think that with some of the strategies we've talked about earlier, or you've heard about earlier, you'll be able to manage your low back pain. If it becomes persistent, or if it's acute to the point that it is actually impacting and stopping you from doing what you want to do, then that is the time to seek some advice.
Well, for prevention of recurrence, the best strategy that you've got is to rehabilitate your muscle system. Your muscle system is the only system that can actually take over from a joint, for example, that's been injured. So while decreasing pain is always an important aspect of treatment, if your aim is to prevent recurrences, then it's exercise that takes primary place.
Having a multidisciplinary or holistic approach to the person with low back pain is really important, because usually not one component works. So we can have medication, which we look at the biomedical side of things, but that's not the only answer. There are other things that can help support that person. So we look at the physical side of things, so we look at function, and we look at the diet and lifestyle, because nutrition plays a huge role in helping people, because a lot of our diets can be quite inflammatory with a lot of the processed foods. We also look at people's anxiety and stress levels, so we help them sort of manage those through various strategies, relaxation exercises, sleep, all of those things. So we're looking at lots of aspects of people, so that's why that whole person approach is very important. So, and the other thing is that if we have one thing, it stands alone. It's not as strong as having everything else. So that's why we promote that as our best management techniques.